Hi, I'm Dr. Rajani. Thanks for joining me today. I'm talking PlasmaEyes. The under eye is very sought after for treatment because the skin is thin. There is some movement. There's also bony changes, muscular changes around the eye. A lot of people get neuromodulators like botox, dysport, and Xeomin. And what happens, you get a little atrophy of the muscle. And a lot of people will get a result with those neuromodulators because they stop muscle movement. They'll do some microtox or little micro injections of neuromodulator around the eye. They might even use some skin cream, but at a certain point, those lines catch up and then the neuromodulators do not work anymore. Why? There's not enough collagen. Things like biostimulators, calcium hydroxylapatite, Radius, Sculptra, Belafil. Those collagen stimulators should not be used under the eyes. I've talked about that for over 10 years. They're non-dissolvable. You might get away with it for a while, but there's going to be a certain risk, and let's call it for nodules, let's just call it, if you're real good, 1 in 50. That's too much. You're going to get 1 a week. People who inject are seeing at least 50 patients a week. So 1 a week, definitely 1 a month. That's even if you're seeing, 15 patients a week, which is nothing, you're going to see 1 in a month. Way too high of a risk. And you can't dissolve those nodules. So what is PlasmaEyes? How do I use it? What's it for? How did it come to be? What do you do to get your best under eye? And I'm going to talk a little bit of skincare with it too. It is going to be a quick one, a Raji's quick clip. Hang on here in 3 seconds. Don't forget, if you like these videos, subscribe, click like. The better we do, the more our algorithm improves with the likes that you click, the more videos I can do for you, the more education. Education is power. So the under eye, and what I'm talking about is the area right under the eye, and you can even go up with PlasmaEyes into the lid area. The reason is you're going in there with your own body's blood product. You're not putting filler. Of course, it's not going to draw water in. We're using platelet-rich fibrin with a micro cannula injection technique, break up any adhesions, and then we're placing your own blood product in there. Why would this develop? Why would you need something like this? And why would you want to get a blood draw, put it under your eye? The reason is, watch my video on, I think I called it Under Eye Disaster or Under Eye Gone Wrong. There's several. You can watch me dissolving under eyes. A busy clinic is going to be dissolving under eyes once every week or two because now patients see multiple clinics. We have our own patients that have had clinics for years. You can watch my video on my PlasmaEyes. I dissolved everything. This is one treatment of PlasmaEyes, and I'll do a second one, and I'm guesstimating a little IPL, a little bit of filler before it's over, but it takes a little time because I got to get myself into my own clinic, which is hard to do when you're injecting all the time and you're getting injected and hopping on planes and different things. So that you can go watch that, though. I talk through it. Nurse Jamie does it for me, and you can hear and see what it is. There's no anesthetic necessary, but filler draws water in, and filler lasts a long time. People say, well, how long's filler last? And I'm going through a study. You can watch my video. The most recent one's going to be on Revonce's Teoxane line. Fillers, they might have a 6-month, 1 year, sometimes a 2-year indication. We know they last longer in the body. Personally, you can look at my PlasmaEyes video. My Voluma was in there for 5 years, which I love, but every year I dissolved a little bit because it would grab a little bit of water. I wasn't unhappy about it. It was totally fine. You just had to manage it. That's what fillers are all about. But that's a 5-year duration under the eye for various reasons in various areas, given the depth you put it, the muscle movement, and individuals, because we have 5, actually technically 6 different types of hyaluronidase in our body, meaning we break down filler at different rates. Different people have different amounts in their body, but that's one way we break down filler. Movement, different areas, migration. It lasts a long time, so we simply dissolve it. But biostimulators you can't dissolve. So PlasmaEyes is important because it uses your own body. You draw the blood, no blood thinners like PRP. People call PRFM, oh, my system does PRF and we do double spins and all this stuff. It's not real PRF, in my opinion. Real PRF, you have 16 to 17 minutes. You don't need to add calcium or anything, because that's the problem with PRF, is it can sometimes premature clot. If people don't make it properly, or the tube's not perfectly spun with the right angle, with a perfectly smooth inner diameter and the right size tube, it will be frustrating to clinics, and they just simply go, let's just add some blood thinner. But why do you want blood thinner? You'd never pour blood thinner on a clot. If you cut yourself, why do you want it in your body? Most commonly, you'll see in the tubes a little liquid, sodium citrate or heparin. That's also why it stings. PRF does not hurt. You can watch me get mine. No anesthetic, and I don't use it for my patients. It's unnecessary. But what it does is it forms that clot. So you'll have a little sausagey look underneath the eye, especially if you don't have a deep hollow, because you don't like the look of that clot. It dissipates over about 3 to 5 days. Now, I'd rather it be there 10 days, because it's slowly dripping growth factors into the skin, thickening the dermis and improving the look of the skin, brightening it. Likely it helps with lymphatic drainage. Again, it's your own body's product. We don't know the full mechanisms. I can sit here and pretend and tell you all the growth factors. It mobilizing the mesenchymal stem cells. But what we do know is if you take a blade and you cut your skin, as long as you're healthy and you don't pick the scab off, you will have new skin developing on your body in days, of course, and in a week, your skin will probably look pretty good, like you never had a cut there, unless you're keloid scar. And that hasn't been a problem with PlasmaEyes, but we're using your own healing factors, just like if you cut yourself, recruited to improve the whole area. So yes, seems to, with our patients, and we're over 4,000, near 5,000 now in my practice, brighten the skin, tighten the skin. My guess is help a little with lymphatics. We use it on top of filler, below filler, with filler. It really depends on what we see. A lot of times, like in my case, we'll dissolve all the filler, do your PlasmaEyes, wait a month or two, see what response you get. I'm 2 months out, maybe you can watch my video. I'll do one more. I would have liked to have had it a couple weeks ago. And then if I need filler, I'll do it. It's nicer also in that window of time when there's no filler to do your injectable RF, chemical peel, be careful on your post-care, and you can also do other procedures like IPL to help with brown spots, sun damage if you haven't worn your sunglasses, or just freckles that you get, and also with vascularity, because sometimes dark circles are from vascular issues. And IPL, using the right filter, or lasers, other lasers, specific wavelengths, 550s, 570s, 600 wavelength, will help rejuvenate that area. So everyone has their own formula. Injecting your own body, it's not a filler, it doesn't attract water. Everyone's response is going to be a little different. So go to PlasmaEyes.com. You can see more there. Every clinic, every practitioner is going to have their solution. There's no one solution. This is an art. Every under eye is different. I can tell you what I did. It probably doesn't remotely apply to you. Maybe you've never had filler. Maybe your dark circles are more genetic. Maybe it's all skin discoloration and you have good fat. Someone in my size and stature, and not a lot of body fat, I'm going to probably need a little bit of volume. A male, likely maintaining a little more than a 50-year-old female, is going to have a little more bone loss, maybe a little more rotation of the eye socket. And therefore, we might need to address the brow a little bit to lift the edge of the brow. Maybe we need to do plasma brow because there's loss of hair above, and hair, the brow hair, frames the eye. So it's not just the under eye, it's also the brow. Very complex to create beauty, and I have a whole series, Creating Beauty. Make sure you watch that. We talk in more details about the angles, about the eye, about the cat eye, all those different types of treatments. So PlasmaEyes, the under eye is difficult, it's tough. Many clinics will not even inject filler under eyes, especially if there's a group of injectors, because they're doing so much volume that they'll get a call back a day or two. And now people don't wait 2 weeks for it to settle in. They wait 2 hours. You get the call that night. Doesn't look right. There's a lump, there's a bump, there's a bruise. So it's complex, but I love PlasmaEyes. We're almost at 5,000 procedures now. High satisfaction rate. That's what I do for my patients. Your own practitioners are going to have their formulas. The key is understanding it's complex and that fillers aren't the be-all, end-all under the eye. There's other treatments necessary. For me, a holistic approach as much as possible in that area is preferred. Thanks for joining me. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.